Hi, I'm Dr. Zac Watkins, functional medicine doctor and founder of the Live Well Clinic, and I want to thank you for downloading my guide on 5 common reasons that people have difficulty losing weight, even though they may be working out, even though they may be cutting calories. There's a lot of things, particularly 5, that traditional ways of evaluating patients' health can be ignored or missed. And this may be one of the keys that you're missing. So I'm excited that you downloaded the guide, but I really wanted to share with you the number one reason to kind of kick this off. And the number one reason that people have difficulty losing weight, even though they may be doing everything right, is because of their thyroid. Their thyroid that may not be working properly. Now some may say, well, my thyroid has been told it works fine. I got my thyroid evaluated, maybe I have some fatigue, I've difficulty losing weight, I'm having some symptoms, but my doctor said my thyroid is completely normal. Well, that's where I would challenge that thinking and invite you to investigate this more. So the thyroid is the gland that is going to make the hormones for the body, and the thyroid hormones for the body kind of turn up metabolism, help your GI tract. They do a lot of good things in the body that we need it to do. But typically in our brain here, what we make is a hormone, which I'm sure you're familiar with, called TSH, thyroid stimulating hormone. And that's what normally is tested to say, is your thyroid working or not? Well, you tell me, if you want to know if your thyroid is working, would you want to actually check your thyroid, or would you want to check the hormone in your brain? So TSH is a brain hormone. It tells the thyroid, hey, Mr. or Miss Thyroid, please make more hormone. So that way I can help with metabolism, that can help with the normal physiological processes that go in the body. Well, that's great. So if we're seeing a normal level here, but we may have a lot of dysfunctions down here, we're missing that traditionally. Other things I want to show you. We have a liver where your hormone goes in and it starts to become more active. Active meaning is what your body needs to make things happen, especially metabolism. Well, let's say your liver is not working the best. This could be due to nutrition deficiencies. This could be to what you've maybe heard of having trouble detoxifying or cleaning the body. That can be a big problem. Another area is your GI tract, and I'll just make a little tube. So thyroid hormones, any hormones, go through the GI tract, and if we have things like constipation or bacteria infections or imbalances, that actually can make our hormone that we need to get rid of be more active and prevent us from still metabolizing correctly. You see, we make cells in the body, and these hormones, messages, got to go to the cells in and make their message work and make the cells do their job, help us metabolize, help us do the things that keep us well. Well, just like a gate in the garden, we want the gate to open so we can walk in and enjoy the fruits of the garden. Well, this gate can be shut. Why is it shut? Because of multiple other reasons. That can be to chronic stress, blood sugar problems, not sleeping well, poor diet, lots of other items that we need to be investigating. So as you can see, just checking out your brain hormone does not rule out your GI tract, does not rule out how well your body and your liver detoxify, does not tell me if your thyroid is actually making the right hormones, does not tell me if your cells are actually using the hormone. So when you say your thyroid's normal by this marker, I would say you've got about 8 other options you got to look at. So if you're having difficulty losing weight, the number one reason we see at the Live Well Clinic is because people have these other things going on that are not being investigated. So I challenge you to think about other ways. Dig to the root cause of your symptom, not just band-aiding or masking it. So at the Live Well Clinic, that's what we do as functional medicine providers. We find those underlying causes and triggers that are making you feel the way you do, that are making you not maybe lose weight the way you want to lose weight. People are cutting calories, people are trying all the different diets out there, people are working out twice a day, and those things may be good, but they also may be detrimental based off these other things. So there's other reasons, and there's more reasons coming in the guide that you've downloaded. I'm super excited for you to read that. So if you have questions, I would invite you to email our clinic or give us a call, and kind of find out more, ask more questions. We also have information sessions that patients come to that they want to learn more about us. What do we do? How can you help me get to the bottom of maybe my metabolism problems that haven't been investigated before? This is what we do. So I would invite you to click the link below to find one of our next sessions. You can come and learn more. This isn't a pitch or anything. It's just to say, am I missing other answers to my health and I may not be getting? And maybe we could be a source of support for you.